Hi everyone, it's Dr. Arshad from the Brooke Surgery. Today we're joined by our guest here today, Claire Debbie, and she's the Health and Wellbeing Coordinator from Be Well Tameside. And I'll just let Claire say hello.
Oh, hi. Oh, thanks very much for inviting me along tonight. Yes, so I'm Claire from Be Well Tameside, and my role within the team is to coordinate and manage part of the team.
Oh, fantastic! And the reason we, spoke to Be Well and wanted to kind of let our patients know about Be Well is because they offer a whole range of services. Some that you are aware of as patients and you're using, and some that you might not be aware of, but actually be very beneficial for you. So we thought it'd be a good opportunity to have a chat with Be Well, see what they can offer you as patients, and kind of go through, what kind of things are relevant for you, how you get onto them. So I think it's worthwhile mentioning that Be Well Tameside is a service for the whole of Tameside, so long as you live, work, or have a GP in Tameside. So let's get to it, Claire. So what is Be Well Tameside, and what services do you provide?
Okay, so we're a free NHS service. We're part of Pennine Care Foundation Trust, and we're a health and wellbeing service. And I'll just run through some of the services that we provide. So the core of our service is we provide one-to-one support for clients who need support with their well-being. So whether that's stopping smoking, healthy eating, weight loss, helping people stress less, sleep better, and move more. So that's kind of the core of our service, and we're supporting people one-to-one. Now, that has changed over the last 6 months. We've gone from supporting people in community venues to currently supporting them over the phone or via video call. So, yeah, that's where we're at the moment. We also have a training team, and our training team, they train the public, we train other professionals and volunteers on all things health and wellbeing. And I want you to watch out because we've got some, between now and Christmas, we should have some really good courses coming up. We're just getting up and going with that. So we'll let all your patients know about that. We've also got our oral health team, or our teeth team, as you like to call them, and they are delivering training on all things oral health, and also they do like schemes around Tameside to help, especially with the under fives. We've also got our community team, and they provide community health checks. They are normally out and about in the community, promoting health and wellbeing, and we get involved in local and national campaigns. So just to say, at the moment, we're right in the middle of the Stoptober campaign. So we're joining in with the national Stoptober campaign to help people to stop smoking.
So fantastic. So it seems like you've got a whole host of really kind of services that patients can access. And I guess if we think about healthcare as a whole system, patients do often go to the GP and access the GP for help, and they've got the pharmacists and you've got the local community. But I guess the biggest benefit of Be Well is that you have a whole host of things. It's not just smoking and it's not just weight loss. It's general well-being, sleep as well, and a number of other factors. And I guess one of the big selling points here is that one-to-one as well, so patients can benefit from advice over a period of time. I think that's definitely a fantastic service, and it is a service that we recommend to our patients here. So I'm really grateful that we've got you here to kind of talk us through what you do. So for people who are watching that haven't heard of yourselves, how do they actually access your service?
Okay, so people can self-refer into Be Well Tameside. So they could give us a call on 0161 716 2000. Drop us an email. Let me just check the email address. It's bewelltameside@nhs.net. Because we know that it's difficult to make that first call. So it might be that you do want to start off with an email, or also we've got 3 social media platforms that you can reach out and contact us on via message. So we've got our Facebook account, our Twitter account, our Instagram, and you just need to look at Be Well Tameside. And it'd be great if you could follow us on there, because you'll get loads of tips and tricks. And my team will be so pleased because I've given them a target to get to for Christmas, how many followers we get. So I'm helping them out tonight.
So, I mean, we just had a question come through from Anne-Marie, and she said, I need to start, but I need motivation. So I guess, you kind of answered it there. If you're finding it hard to pick up the phone to kind of get that motivation, they could email, and couldn't they, or message on social media to kind of start those initial steps?
They could, and I think what's kind of important for your patients to know is that, just making that first phone call, it doesn't mean that you then have to carry on the journey. If you just wanted to chat to someone and find out more, but it's important to tell to tell everyone that everybody's journey is different, and everybody's health and well-being, there's different parts that you want to work on. So it's a very personalised programme. If you come to us because you want to lose weight, it's not about us telling you what to eat and when to eat it. It's about looking about the small changes that you could make that are going to make huge benefits to your health.
Fantastic. What I'll also do as we're going through this live interview, I'll just share your details for your phone number and your email, just so that people can access it as we're going along. So one of the other questions that we wanted to ask you, really, so you mentioned that they can self-refer via the phone, email, or even social media. What happens after you do that initial kind of contact? What are they to expect, really?
Okay, so if a client wants to come into the main service, once they've had that first phone call, we will have a chat to you and just take your details, medical history, anything else that we might need to consider, and then we'd arrange the first appointment for you. We're a really flexible service. We work Monday to Saturday, some evenings and weekends, and some early mornings. So we try and find the first appointment that's best for you. As I said, at the moment, it's phone or video call. And then during that first appointment, we would find out what it is that you want to work on, and how we're going to make some plans and some small goals to move forward.
So that's fantastic. So it sounds like your timings are very flexible. So people who have commitments, or people who are working, or they can't get through to you during the working week, it sounds like you have some availabilities around that to kind of work around the patients, isn't it?
Yeah, definitely. And I think what we've found over the past 6 months is being able to offer phone and video appointments has made it even easier for people to access us. Obviously, we have some barriers. We can't weigh somebody if they're not in the same room as us. We can't take a blood pressure, but that is something we're working towards, getting back into community settings. But we've had some really positive feedback over the past 6 months because people have been able to fit it in to their busy lives.
Fantastic. So it's good to hear that you can shape it around the needs of the patient, really.
Yeah.
A couple of questions. Sorry, go ahead, Claire. Sorry.
No, I was just going to say, and it's not like you're committed to, your appointments every week. Once you've had your first appointment, it will then be a decision on how often you would need supporting. What we're trying to do is empower people, and it's not about us telling you, it's about you gaining the skills to be able to lead a healthier lifestyle. So don't think, oh, I haven't got time to go every week, because that's not what we're about.
I'm glad you said that, because that's often sometimes what patients need to hear as well, isn't it? You know, it's not going to be a weekly commitment where they have to take up time. Actually, they can make it work with their lifestyle. And that's very important, because as we know, if you want any change in life, if you want any improvement, it has to be reasonable. It has to be something that you can commit to and make it work for your life. So it's really fantastic to hear that that's what your services actually offer. And there's a question that came through from Emma. It says here, is it a self-referral only? Is that what we normally do?
No, I mean, you can self-refer, but we work with a lot of other agencies. So we get a number of referrals from GPs, from the hospital, from Active Tameside, any other health professionals. Part of our community team's role is making our service available. Clients can be referred in from health professional, anywhere.
Fantastic. So basically, if they have access to that email and that phone number, anyone can refer in. So that's great to hear. So one of the other thoughts, one of the leading question that we had recently is that during COVID, people's lives have radically changed. They're not as active as they once were before. Even kind of the dietary kind of habits have changed. People are more likely to snack or turn to more kind of calorie-rich foods, comfort eating type of kind of scenario. Some which is even subconscious and just because of the situation that we're in. And because of that, as a consequence, people have put on weight. A lot of my patients I was speaking to today, they were talking to me about how they've been struggling with that. And the kind of, we've seen high cholesterol, diabetic care getting worse, and overall health getting worse. Do you have any kind of tips for our viewers, kind of general tips on how they can perhaps start the journey on losing weight?
Yeah, I mean, the 4 words that I always remember, which make it sound really simple, are eat less, move more. And it sounds really easy to do, doesn't it? But it's simple, but it works. So let's break that down a little bit. So eating less, it is kind of probably looking at our portion sizes. And, quite often, we're giving ourselves much more than we really need. An important thing that our advisors do is they discuss with the clients whether they are confident with label reading. So when they're buying things, do they actually know what they're buying? We need to perhaps be looking at increasing our fluid. Always have your water with you, and increasing fluid, and making sure the drinks you're having, it's no point having Coke or having sugary cordials. It's kind of looking, because they're, you're getting a lot of calories in your drinks. So looking at increasing your fluid, increasing your fruit and your veg, and cutting down on your fats and your sugars. But for me, I think one thing probably that's come out of COVID is that's really important is it's the planning of your meals. If you can plan your meals for the week and you know what you're going to have when you're going to have it, you're less likely to go off track. And also, going back to what you've just said, is eating mindfully. A lot of us are eating on the go, we're eating on the run, where it's kind of, if you make time to sit down and think about what you're eating and take your time, then we're more likely to eat less. Yeah.
I think they're fantastic tips there, really. I think, a couple of the points that you mentioned there, often we are consuming things that are either very high in sugar and calories, and we don't actually realize. So getting a flavored coffee from a coffee shop can have a lot more coffee calories than we realize. Or even some of the, for example, cereals that we have, or kind of tin foods, or even microwave foods, they have a lot more sugar content than we would assume if we had made them from scratch. So I think that's a very important piece of advice there. And planning again. I know even in our workplace, whenever you're having a busy day, often you turn to something high calorie, sugary when you haven't got something ready. But if you had something ready in place, I guess it's easy to turn to, isn't it? And you're less likely to trip up and go for something that's going to set you back. So fantastic advice there. And I guess, if people want to follow on from that, they can, get in touch with Be Well and follow on from this, delve into it.
Yeah, totally. And I say, look out the next few months. We're going to have some education sessions, probably online, virtual. But, we're going to encourage people to come along. So, yeah, that'd be good.
So I guess the message here is to follow you on social media.
Yeah.
Absolutely.
Sure is.
And on that note, do you have any case studies that you can share with us of patients that have gone through the service and the kind of the benefits they have kind of achieved?
Yeah, I can. That's fine. And if you go onto our social media, we are always sharing our clients. But if you looked on at the moment in our Stoptober campaign, there's a gentleman who's shared his story, and it's been, it has been shared by Tameside Council as well. And it's a gentleman. He's 63 years old. He's been smoking since he was 13 years old. So he's been smoking for 50 years. Long-term condition. So he's got COPD, diabetes, high blood pressure, vascular dementia. He'd never even thought about giving up smoking. He had 2 strokes and ended up in hospital. And the medical professionals in hospital had suggested that, it would really benefit his health if he could give up smoking. So they referred him into our service. He started in hospital. He started with the nicotine patches. He then got referred to one of our advisors. And he actually swapped then, and he used a nasal spray and lozenges. And he's now been 12 weeks smoke-free. So it's not just been the products, it's been the behavioural support as well. So can you imagine that? Somebody's been smoking for 50 years and has been able to give up. And he said, it's not only been great for my health, his tastes come back, his sense of smells come back, he's not coughing as much, and he says he feels so much better in himself. But then just think about it. If you're a smoker, and forgive me, I'm not really that great with numbers, but this is one I do remember. If you smoke 10 a day over a month, if you gave up, you'd save £165. And I think a lot of smokers smoke more than 10 a day. So it's the money that you're saving as well. But I mean, that's just one of our smoking case studies. But he is our poster boy for Stoptober. And he's just done so well. So that's one of our smoking ones. And then shall I tell you about one of our weight loss ladies?
Yes, please.
Yeah. So a lady from Denton, she's 55 years old. And she was pre-diabetic. She'd been told by her GP that she was pre-diabetic and she had a high cholesterol. And she'd gone along to an event that was organised by the GPs for people that were pre-diabetic. And our team were there. So they had a chat with her and she came into our service. She, over, I think it was a 10-month period, she managed to lose 3 stone. And she said that she didn't have any understanding, she had a limited understanding of what foods contain sugars. So by learning about label reading, and also for her, she said cutting down on alcohol, she didn't realise how many calories and how much sugar she was consuming through alcohol. She switched to whole grain foods, she increased her fruits, her proteins and her fibre, and she started exercising. And she also said, and I think this is a really important thing for everybody out there, the exercise as well. She said as people started to notice she was losing weight, they were saying how great she looked, that boosted her self-esteem and her confidence, and she said she feels 10 years younger. And the best bit is she's no longer pre-diabetic. So that's just another one of our clients. And
oh, wow.
Yeah, I mean, sorry, I lost you. I could go on all night because I'm so proud of our staff and the work they do, but I'll just leave you with those 2 today.
I mean, they're amazing success stories. I mean, giving up smoking and for someone who's done it for so long, and then also the weight loss story. I mean, both fantastic stories. And I think, patients watching this, they can probably relate to this and think, look, I could be that person. I could stop smoking with the help of Be Well Tame Side, or I can help, get myself to a weight that I'll be happier with, and with the help of Be Well Tame Side. So really, I want to thank you, Claire, for kind of coming on here, explaining what Be Well do, and opening up your services for everyone. Because for those who aren't aware, this will hopefully, put you on the radar and give them a chance to engage with you. And those who are aware and just haven't made that jump, maybe this is the opportunity where they say, right, this is a step that I take to take control of my life and feel good about myself.
Yeah, I think so. We're here, we're waiting, we're ready to help. And I know I'm biased, but we've got a really good team. They're really friendly, really adaptable. And give us a call, drop us an email, or give us a DM, and we can be back in touch with you.
That's fantastic. So for everyone watching, make sure you follow Be Well Tame Side on your social media. I've sent the referral details to self-refer, the phone number and the email. So don't delay it. Send them an email today. The psychology of making change is that if you make the change now, today, you start the ball rolling, you're more likely to actually make that change. But if you allow it to kind of simmer over, delay it, often it can get put on the back burner. So take control today, get in touch with Be Well, make those changes. And again, thank you so much, Claire. And for those watching, if you think people would benefit from this, please like and share it with your family and friends so that they can all benefit. And if you have any questions, do fire away under this live video, even when it finishes, and we'll do our best to get back to you. And again, thank you again, Claire, for joining us today.
Oh, thanks for inviting me. Thank you.
So bye for now, everyone. Until the next live video. Take care.
Bye.